The debate regarding healthcare reform includes questions of the right to healthcare access, fairness, sustainability, quality, and the amount spent by government. The mixed public-private healthcare system in the United States is the most expensive in the world. The Affordable Care Act was enacted with the goals of increasing the quality and affordability of health insurance while lowering the uninsured rate by expanding public and private insurance coverage and reducing the cost of healthcare for individuals and the government. But just how does healthcare reform affect your business? Greetings, everyone, and welcome from the Technology Association of Georgia. It's Tuesday, January 19th, 2016, and this is Tech Talk. I'm your host, Frank Baia. Sweeping federal healthcare reform involves major changes to the way businesses insure their employees. In this edition of Tech Talk, health insurance and sweeping healthcare reform and why it pays to be aware of what lies ahead. Up to the Tech Talk, Rick Elliott, Executive Vice President and partner of Lockton, the world's largest privately held insurance consulting and brokerage firm. Rick has been in the insurance, employee benefits, and healthcare industry for 33 years. He joined Lockton from United Healthcare, where he was president and CEO of their Georgia insurance and HMO plans. A pioneer in the industry in the early stages of managed care and technology solutions, he is industry-recognized expert for his performance in developing unique solutions to drive quality and affordable healthcare solutions in partnership with healthcare systems. Just how has the Affordable Care Act impacted health insurance? What are companies doing to manage healthcare costs? From the key changes employers are facing today to how the market will be impacted over the next few years, plus a unique insight to how changes in the healthcare market are impacting the technology world. It's a Tech Talk filled with valuable and important knowledge every employer needs to know. An exclusive market update on health insurance, healthcare, and healthcare reform as we Tech Talk with Lockton Executive Vice President and partner, Rick Elliott. This edition of Tech Talk is brought to you by GlobalSpeak.com, new media consultants, corporate video and audio communications, video and audio production and distribution, live and virtual event production. Tag TV and Tag Radio is a service of GlobalSpeak.com, creatively delivering powerful marketing, video, and audio solutions. Rick, welcome to Tech Talk.
Hey, Frank, how are you today?
Oh, fine. I got to tell you that without question, it seems to me that I can't have a conversation with anybody that they're not talking about talent acquisition and the retention issue and labor force and unemployment and employment records for 2016. Looks like it's going to be a banner year. Certainly, some of the things that are crucially important are going to be the key changes that employers are facing with health insurance plans. So let maybe start there. Talk a little bit about what should they be offering their employees.
Well, it's a great question, and one thing about my world of employee benefits and healthcare and health insurance is it's getting more and more complex. It's never boring, and so we work with all of our clients to help them sift through this complex maze of trying to develop and offer competitive benefit packages and health insurance and create employee benefit plans, et cetera. So, if I were to condense it down into a few things, I guess, just some key items. First of all, just the changing workforce, and you guys in the tech world know this. You've got Generation X and Generation Y, and certainly their needs and expectations from what they get in their benefits or what their work culture is different than, say, older employees, those that might be in their 50s, et cetera. So that's clearly an interesting dynamic. And then, most businesses are being asked to do more with less. It's not like they have a ton of money sitting around to spend on things that might have been available years ago. So, continued cost pressures, trying to figure out how to prioritize their spends, et cetera, always make it challenging. And then we can't talk about employee benefits or insurance without, affordable health care and the Accountable Care Act, or what we call ACA.
Oh, that.
You're familiar with ACA?
Enough to, I won't make a political comment one way or the other, but enough to know that it exists and it's impacting my business and a lot of the businesses that I deal with. So maybe that's a really good one to segue into. You mentioned that being one of the changes that have to face it. How has this law impacted health insurance?
Well, it's a very complex law, and as you said in your opening comments, it's hard to go anywhere, particularly in my line of business, when I don't meet somebody who's interested in the ACA or curious about it or wondering how it impacts their business or their own personal world. So, we could probably spend a whole day talking about the ACA, but I assume you're not interested in the college professor version, but maybe a few condensed highlights. Is that sort of where you'd like to go?
Let's start with that, but I got a feeling that a lot of our listeners would want to learn more. So, but give us a little teaser, if you will, or at least a briefing.
Yeah. So if I were to condense it down into maybe a half dozen points or so. First of all, and hopefully everybody listening today is familiar with a lot of these pieces of it, but the law requires that every individual in the United States has some form of health insurance, and that certainly didn't exist before the Affordable Care Act. So if you're an individual listening to this, you either have to have insurance through work, you have to have an individual policy, you have to have Medicare or Medicaid or military or wherever you happen to be that allows you to purchase insurance. But you can no longer go without health insurance, and if you don't, there's a penalty. Last year, the first year this was enacted in 2015, it was a relatively modest penalty, a little less than $400, and then this year in 2016, if you don't have health insurance, it gets a little more complex. It's a function of your income and a formula to determine your penalty, so you got to have it. And so that's kind of one key item to point out. Second point I would remind our listeners is that the law requires that anyone who does purchase insurance cannot be denied based on any kind of pre-existing condition or other health factors. So a very important part of the law is that insurance companies can no longer deny coverage to anybody, and I'd say most folks would say that's a very good thing if you've ever been around someone or a family member yourself who's got a health issue. So those are kind of the first two. The third one I would point out, and this is a little bit more of the complexity of the law, and that's that any business in the U.S. that has more than 50 full-time employees now has to offer health insurance to all of their employees. And this is probably one of the more controversial aspects of the law, the so-called employer mandate. So all businesses over 50 full-time employees, and there's a very complex formula to determine if you have more than 50 full-time employees, must offer insurance, and the government, making sure you don't pull any tricks, has some pieces to that mandate. The first of which is you have to offer at least a certain level of coverage. You can't offer just very minimum rapport coverage. You have to offer a plan that provides some certain level of benefit. It's called at least the minimum value plan. And then the most you can charge your employees who participate in your health insurance plan is about 9.5% of their income. So the law makes it very clear you have to offer it. It has to be a decent plan, and they can only charge so much. So are you keeping up with me so far?
Well, it's getting a little dizzying, but the other side of it is this is the reality check that I think a lot of our listeners have got on either one side of the discussion or the other need to know. So please continue.
Yep. Yeah, so a couple other parts of that provision of the law. So you have to offer it. It has to be affordable. But then in sort of a funny twist, the law also says you can't offer a really, really good plan. And if you do, you have to pay an excise tax above a certain threshold. So if you are an employer or own a business and you want to offer really rich health insurance and cover just about everything, et cetera, the government says no to that in the ACA, and you've probably heard about the so-called Cadillac tax. That's right. So if you do offer one of these rich plans, the employer has to pay an excise tax above and beyond what the government considers just a normal value plan. The bad news around that is all companies had to determine whether or not they're subject to the Cadillac tax, and it was to be implemented in 2018. The good news is, as part of the constantly changing ACA language, that has now been pushed into 2020. So everybody gets a couple years of flexibility before they have to comply with the Cadillac tax. Don't know if you're aware of that, but that's a nice little benefit.
Well, go ahead. I was going to inject that one of the things about the entire employment and retention acquisition area is the environment is ever changing, and something like how do you remain competitive for the purposes of retention could easily fall into the category of the quality of health care that you offer. So over the next couple of years, that could become even a more important issue than even it exists today.
Yeah, no point, and that's, again, part of the reason the Cadillac tax has been so such an issue and controversial. And in fact, almost interestingly enough, every side of the political equation is against the Cadillac tax, Democrats, Republicans, unions, so it's an odd part of the law. So before I lose everybody with too many complexities, I'll just hit on a couple more highlights about ACA, and again, these are very important. So first of all, the law also requires insurance companies that offer health insurance to actually cap the profits they can make off of the premiums they charge. So the law requires them to pay, depending on which license they're using, either 80 or 85% of every dollar they take in to actually pay doctor and hospital bills for the covered participants in their programs. And if they don't spend that much, they have to give that money back to their customers in the form of a rebate. So that's an interesting part of the law. And then a couple other ones. Probably everybody's hearing about these public exchanges where individuals can go online and shop for insurance through healthcare.gov. And within that, you get multiple options of plans and pricing and deductibles, et cetera. And it also helps you determine if you're eligible for a subsidy, which was part of the law. So those individuals that make below certain thresholds, either themselves or their family, will get a government support for their premiums. In fact, it might be zero premiums for you, depending on your income level, if you buy your insurance through the public exchange. And then lastly, and this one tends to be sort of front of mind for most of our clients today, is the law requires that all employers who are over 50 employees and have to adhere to the ACA, they actually have to send a tax form out for the first time starting in January of this year for everybody that worked for them last year in 2015, looking back a couple of years actually, and they get a tax form that says they were either covered or not covered under that company's specific plan. So imagine the complexities of, matching payroll systems and employment records to track down every single employee and get this form in their hands. And again, a little bit of good news for employers is that law was requiring all of those documents had to be out by the end of January this month of 2016, but because of a lot of pushback, they've extended that to the end of March. So all of our clients are feverishly trying to get those forms out and comply with that kind of tax side of the law. So anyway, those are, about a half dozen points on now a 10,000 plus page bill. But those are some of the highlights that our clients are wrestling with, and to your comment, trying to offer attractive benefit package and use your dollars wisely and spend money the best you can for your employees. Now you're sort of consumed with trying to comply with this very complex law, which is expensive and all that comes with it. So that's the few-minute version.
At the risk of sounding commercial, I got to say, as you go through it, I can't even believe anyone trying to do it alone without having someone like to be there to give them some insight and then some consulting along the way. We haven't even touched upon healthcare costs. Let's go into that a little bit. What are companies doing to manage their healthcare costs?
Yeah, so aside from the complexities of the ACA and trying to comply, as we all know, healthcare continues to be more and more expensive, and I think some critics of the ACA, which that first word is Affordable Care Act, would say it's still not quite affordable and continues to rise at a rate higher than inflation. So our clients are, trying all sorts of things depending on the size and the resources the company has to manage their healthcare costs, including, small businesses that primarily they just shop their insurance every year and try to get competitive quotes and continue to leverage the marketplace. But as companies grow and get more sophisticated, a few of the things we see almost all of our clients doing today would be to implement some form or fashion of a wellness program. And that takes many different forms with many different companies. But the main goal there is to make sure employees are aware of their own health situation, to offer tools and resources to them to measure and monitor their health. Oftentimes now companies are doing blood screenings on site and helping employees kind of quote-unquote know their numbers and identify the risks. And then wellness takes all different forms of companies that are building, on-site gyms and supporting people with fitness and diet and diabetes management and all of those kind of issues. Some other things they're doing is, using data to identify where the risks in their company might exist. Do they have a lot of smokers? Do they have a lot of diabetics? Do they have people with chronic illnesses? And if so, can they customize a program that might help employees in those various disease categories manage their disease, avoid emergency room visits, stay out of the hospital, stay healthy? And then lastly, in the broad category of kind of managing healthcare costs, probably the single biggest spotlight today is on prescription drug costs, which are typically rising, somewhere 3, 4, 5 times even faster than normal healthcare inflation. And so a lot of our clients are really turning their attention and looking at data and information around what they're spending on prescription drugs on behalf of their employees and families and how they can structure their program to get the best bang for their buck.
The more that you hear a lot about work-life balance, and I think it's a case where the work environment really is going to become so much more challenging as it relates to, quote-unquote, a cultural aspect of what role it plays in its interrelationship with its employees and its relationship through those employees with an entire family and then the makings of teams internally. I mean, the layers and tentacles have just got to be amazing. Let's talk a little bit about that from your perspective, and I guess where I'm leading to now is what changes do you see in the market over the next few years?
Well, yeah, and you've hit on certainly an important one, and that is, just what does work look like for the next generation, and certainly, your contingent of technology firms and people that are in technology are almost taking a leadership role in this. In fact, Mark Zuckerberg, the CEO of Facebook, made a very public announcement as his wife was giving birth that he would take advantage of their family leave and take 2 months of paid leave off as the CEO of a very large company. And
well, how about LinkedIn and self-directed vacations?
Absolutely,
yeah.
Yeah, GoPro, their CEO, has announced they basically have no rules anymore, right? You can come to work when you want, take vacation when you want. So, not every company can be that flexible and that creative, but certainly there is a shift in making work-life balance a part of a culture. And then, beyond that, just in our world of health insurance and kind of where the market's going, a few things that I think your listeners should be aware of. Certainly the consolidation going on in our industry. If you read the journals, there's a lot of acquisitions that have happened and are going to happen. Anthem, which is the largest network of Blue Cross Blue Shield plans, is attempting to buy Cigna, which is the third or fourth largest insurance company, so they'll combine. Aetna's trying to buy Humana, and then you've got United Healthcare. So most of our experts tell us, in the next 2 to 4 years, there's only going to be really 3 major national health insurance companies in the business, which will impact, our customers in the market certainly. And then kind of conversely, we're seeing the same thing happen with healthcare providers and large hospital systems combining or buying each other, and then most of the hospital systems are all now buying physician practices, specialty practices. So, all of us should look towards that happening, and there'll be kind of fewer choices, much bigger choices in both health insurance and then the delivery of healthcare. And then finally, as I look out around the horizon, and this is almost sort of my own personal hope and mission, certainly as it relates to healthcare, is a greater push for transparency. And what I mean by that is just, all of us as consumers of healthcare would probably say, we know very little about where we get care, what it costs, what I'm about to enter into, and so there's a lot of effort, and we see this coming to fruition over the next few years, for people to know up front before their treatment kind of what it costs, what it'll look like, being able to select doctors and hospitals based on the quality and the outcomes that they deliver, not just because they're close by or I like their office or they have good bedside manner, really good, solid information around costs and quality of care that the industry is really starting to push for. And again, personally for me, I think that'd be great for the consumer.
The dynamics are amazing, and they're only going to get either worse or better depending on the benefit aspect and the work that it's going to take or the investment it's going to take to materialize all of the promises that come in the future. As you were talking about consolidation, I'm thinking of Google Healthcare or Amazon Healthcare, because by the time the consolidation goes on, I'm not sure where it's going to stop and whether or not there's just going to be several just large mega somethings that'll that'll be handling everything. And I have to, as we were just finishing up and we were talking about changes in the future, we just had the large technology show and all of the new devices, and one of them is almost a Uber robotic helicopter that comes and picks you up and drops you off. So forget about telemedicine. We'll just come and get you
That's right.
when you're sick, Rick, and we'll bring you in, repair you back, and send you back home. As I mentioned earlier, Rick, I don't know how anyone does it by themselves, and certainly with some of the insights and advice and even some of the overview and the briefing that you provided, I think it makes it pretty clear. This is an important subject. It's one that you really need to know what you're doing. You can't afford to not. You almost need to know what you don't know and make sure you make the right decisions, and that means you can't do it alone. Hey, thanks for taking such amount of time and detail to go over so many good things with us today on Tech Talk, and we really appreciate you taking the time to join us today.
Yep, it's great to be here, Frank. I really appreciate you inviting me on.